elbow simultaneously. Now, as a hardworking executive mom, you're no stranger to juggling multiple responsibilities. And whether you're leading your boardroom meetings or you are cheering your kids at a sports event, or if you are a football mom like me, then taking your kids to football classes, every single lifestyle choice or demand that we have, it takes up a lot of mental and physical agility, right? And but this dynamic routine that you have as a mom or as an executive working in the office can keep you or make you more prone to repetitive stresses. And one of the very common, or rather two of the very common injuries that come out of a repetitive strain is tennis elbow, and the other one is golfer's elbow. Now, it is possible that you get both of these simultaneously in your body, and it can be either on, tennis elbow on one side, golfer's elbow on the other side, or it can be both of them on the same elbow, which makes it even more challenging. So, in today's video, let us talk more about tennis elbow and golfer's elbow occurring simultaneously in the and well, in the same person, I would say, because it could be on either side. All right. So, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is, back and neck, and nerve pain. And of course, I also talk about joint pain because I've been on that journey, and all that I talk about also includes the tips and tricks that I have learned on this pain journey. I also give you some simple exercises, some lifestyle modifications, some easy lifestyle modifications rather, that will help you. And I do all of this without taking away a big chunk of your time because, hey, we're moms, we're busy people, right? All right, let's get on with dual elbow pain. Can you have tennis elbow and golfer's elbow simultaneously? Now, in case you are not aware of what is tennis elbow and what is golfer's elbow, first let's have a very brief look at it, and then we'll talk about this dual or double elbow pain. So, if you look at your elbow, this is the point of the elbow, and if you go 1 to 2 finger breadth on the side of this point here, on either side, there you will feel a bony prominence here. So there is a bony part here on the outer elbow, and same on the inner elbow. Of course, the one on the outer is more prominent. Now, you have a set of muscles. Let's talk about the outer one first. So you have a set of muscles that is attached. Now, whenever you have a muscle in the body, it has to be attached at 2 points, right? So it's like a rope. It has to be attached on two ends. So this bony point here serves as an attachment to these forearm muscles, which are also known as the forearm extensors. I'm telling you these terms so that if your doctor refers to them, or your physical therapist or healthcare professional talks about them, you know what they are referring to. So this bony point is known as lateral epicondyle, or you can just say a bony outer elbow. And this is the attachment point for these muscles here, which then split into these four tendons. So you see these rope-like structures here. So don't look at the thumb; that's a different system altogether. And these ropey tendons go and attach into different parts of your fingers. And when you do this movement, can you see my muscle working over here in this area? So this is the bulk of the muscle. So you will see the movement when I'm moving my wrist, because this muscle crosses over your wrist and into your fingers. Now, if you have had an injury, or you've had a fall, or any kind of trauma, or the most common, you've had a repetitive strain on these forearm extensors, they go and create there is an inflammation that gets created on this outer elbow here on the lateral epicondyle, and that's why it's called lateral epicondylitis, because itis is inflammation. Anyway, enough nerding out on that. So basically, tennis elbow is pain on the outer elbow, and it can go into your forearm and fingers. The reason for explaining all this was so you understand why and how it occurs. Now, let's put this on the other side. So this inner point on the bony point on the elbow, it is the attachment point for these muscles here. So these muscles, again, like the ones at the back, these also split into tendons, and they go in these four fingers. Now, if there is an inflammation or pain, swelling, or redness around this area, basically that is known as a golfer's elbow. It can radiate into your forearm, into your fingers, and different activities that you do. For example, if you're typing and you are not careful and your wrist is like this when you're typing, which most of us are, By the way, you should be in neutral. This is neutral. Okay, we'll talk about this later. But if you're typing and you are repeatedly doing this typing action, do you see how my tendons are moving here? So this repeated stress without a break or for a prolonged period of time can lead to inflammation on the outer elbow and lead to tennis elbow. Similarly, things where you're gripping any object or other activities that stress these flexors or these tendons here can lead to inflammation and on the inner elbow and golfers, that is known as a golfer's elbow. So the common factor for both of these is inflammation, the itis part of the epicondylitis, that is medial or lateral. So there are certain activities where they can be a stress on the inner and the outer, the muscles originating from the inner and the outer elbow. So basically your forearm flexors and your forearm extensors. So for example, uh, plumbing, construction work, or it could be any sports actually. Oh yes, another thing is tennis elbow isn't only restricted to tennis players. It can happen with anybody, and same for golfers elbow is not restricted to golf. So so any sports activities or rock climbing where you're using both the set of muscles and repeatedly using this both the set of muscles can lead to tennis and golfer's elbow happening in the same on the same side. And of course, if you have inflammation, you use this hand more for, say, these muscles here. You can have a golfer's elbow here, you can have a tennis elbow on the other side. However, when you are doing a lot of lifting, gripping, repetitive stress injuries, movements, it is possible that you get them together. Now, as I said, the typical symptom for both these is pain around the elbow, the inflammation in the elbow. You could have pain with lifting objects. Say you're carrying your bag of groceries, you're carrying your baby bag for the little toddler, or you're carrying your little baby, or you're carrying your toddler or child. You can have problems with pouring water from a bottle into a glass, opening doorknobs, wringing some clothes. So these can be the different scenario in which you have elbow pain. You can suspect that it might be either of these conditions, or if you have pain on both sides, it could be both. Now, it is very important to prevent and manage these conditions, of course, but if I'm going to cover that, the video will get too long. So you can have a look at the solutions for tennis elbow and golfer's elbow. These are separate videos that I have done on my YouTube channel. You can go to YouTube, just type my name, Swati Prakash, tennis elbow, or just elbow, and these videos will come up for you. Alrighty, so if you're still not sure what is the source of your elbow pain, I have made a free guide, and which is called "What is the source of your elbow pain?" So you can have a look at that, and I will leave a description I'll leave a link in the description of this video. If you're watching me on Instagram, the link will be in my bio. If you're watching it in the future or you can't find it, just DM me and I'll send it across to you. So that link will lead you to a blog which has more details on this topic of tennis and golfer's elbow, and how can you differentiate if you have one over the other. There's a video inside that blog as well, and there is this free guide, what is the source of your elbow pain. Alrighty, I hope that was useful, and if you have any questions, any comments for me, do let me know and I'll be happy to address them for you.